It certainly has. When I first joined, we didn't talk about mental health. It was an unknown thing. Yeah, you get assaulted, you get exposed to so many incidents, as Belinda's already said, but it just didn't get talked about. So thankfully, taking our leave from the military, who are experienced PTSD well in advance of ourselves, we're talking about mental ill health. And it's so important that it's okay not to be okay. But what mechanisms does policing really have to do with that if an officer comes forward and says, look, Sarge, Governor, I'm not well today? Because we've got a shortage of officers, there's that pressure to be there all the time. We don't feel there's adequate resources in place. That's why we as the Federation have got our own National Welfare Support Programme, which is paid for by members' money to look after members, and Belinda can talk about that quite well. You know, we've had to put things in place to cover the mental health provision and sometimes the physical provision that is so badly needed for our colleagues.
Yeah,
go on, Belinda.
Yeah, just adding on to that, you know, the welfare support programme's been up and running for quite some time now. The last couple of years we've had a different third-party provider for that, but we've seen over nearly 6,000 officers in the last 2 years actually ringing up, picking up the phone, getting a referral. That's massive. So there's gaps within that, but as a federation we're proud that we actually be able to service that. But again, like Steve touched on, that's members' money. It's we're plugging that gap, and we can't continue to do that. You know, it's about officers falling through that net. We want officers to come forward to disclose and say, look, I'm struggling here. We have seen different areas of officers self-medicating, that they, you know, there's things they shouldn't be doing in order to do the job, and that cannot be right. The trauma, the exposure, and when I've said in the past, and I've got into a bit of controversy around it about talking about a job like no other, but we're the first responders more often than not get into an emergency life situation. We're there to perform, you know, the first aid, but we're also there to enforce. I've been in situations where I'm performing emergency first aid to somebody whilst fighting with my other hand, fighting someone off who wants to get to that person. So we're doing both. We're there to uphold the law, to protect the public in order, you know, in order to do that. But we're also there we run into burning buildings. We're also there to prevent, you know, to preserve life. So that's why it's such a nuanced job.
Of course it is.
It's huge, and it's important that the public understand that.